This presentation is a review of the renal system and will serve as a foundation as we introduce acute kidney injury and chronic kidney disease. So think about it this way. In order to understand what goes on when we have a kidney problem, maybe some type of kidney failure, kidney injury, or kidney insufficiency, we need to have a clear understanding of what the kidneys do when they're functioning normally. This way, when we begin to explore these two major kidney problems, acute kidney injury and chronic kidney disease, you can almost anticipate what might happen to these patients if something goes wrong. So considering all of the things that the kidneys were responsible for, what's going to happen when those things aren't happening or aren't happening efficiently. So this should be a review from your anatomy and physiology and pathophysiology classes, but a nice reminder of what you're going to need to know in order to really understand AKI and CKD. So let's quickly remind ourselves of why our kidneys exist and some of their responsibilities. Now remember, blood is basically coming to the kidneys to be filtered, and a lot of blood comes to the kidneys. About 21% of the cardiac output is going to head toward these fairly small organs. So think about that. 21% of the cardiac output is heading for the kidneys. And this blood comes to the kidneys through that big renal artery, which branches off into smaller and smaller vessels and ultimately into arterioles that eventually feed to our nephrons. And you'll recall that nephrons are just those tiny little functional units of the kidneys. So imagine the kidney having about 1 million little mini kidneys within the main kidney. That being said, if you understand what the nephron does, you can almost understand what the whole kidney does. Almost. Emphasis on almost. So, blood comes through the renal artery to be filtered, heading toward the kidney. And this blood might have a little extra water, maybe some extra solutes, some extra electrolytes, a little bit of waste, maybe some byproducts of drug metabolism, some toxins, etc. It's coming to the kidney to kind of get cleaned up and balanced out in a way. The blood isn't coming to the kidney to just dump out all of the water or all of the electrolytes. That wouldn't really make sense. It's coming to kind of equilibrate, to find a balance. And then once that balance is found inside the kidney, the stuff that we didn't need, the waste or maybe extra water or potassium that it didn't need, leaves the body as urine, and the leftover filtered blood that is now clean and the body decided that it needed it is returned back to the system via the renal vein, all nice and clean and balanced, ideally. So how does this filtration process happen in the kidney? Well, remember that nephron, that tiny functional unit of the kidney. Blood is going to reach the nephron, get pushed into the glomerulus, this ball of capillaries with high pressure, and then it gets filtered into the tubule. Now you'll remember the tubule is a long and complicated thing. We have the proximal convoluted tubule, the nephron loop, the distal convoluted tubule, eventually leading to the collecting duct. And as the filtrate in the tubule moves along, remember the different parts of the nephron are going to reabsorb and secrete different chemicals, electrolytes, and water. So what's the difference between reabsorption and secretion? Well, let me give you an example. If there are useful things that actually got sent into the filtrate and are sitting in the tubule, it can be sent back into the bloodstream to be used up in the blood, to remain in the bloodstream because we don't need to get rid of it. That's called tubular reabsorption, stuff going from the tubule to the bloodstream. But now if the nephron starts to notice the opposite, so that there's still waste in the bloodstream and they didn't get into the filtrate back in the glomerulus, we can actually still remove those wastes in the blood and add them to the filtrate later on through tubular secretion. So reabsorption is stuff leaving the tubule and going to the blood, and secretion is things leaving the blood and going to the tubule later on after we've already had that glomerular filtration. So even later on in the tubule, we may have some water conservation where if the kidney senses that we shouldn't just get rid of all this water, we'll send water out of the filtrate, out of the tubule, and concentrate the urine more. So we're going to have less water in the urine, making it more concentrated. It also can add more water to the urine to dilute the urine. So that's kind of one of the other responsibilities of the tubule, is to decide how much water do we need to conserve and how much water do we need to get rid of. So some of the big picture things to think about here. Throughout tubular secretion, the vessels will reabsorb sodium, chloride, and even some water, so it's going back into the bloodstream. And during tubular secretion, the blood is going to dump those metabolic wastes, maybe some drugs or byproducts of drug metabolism, ammonia, hydrogen, and potassium. Specifically to potassium, the kidneys are responsible for excreting about 90% of our daily potassium intake. So let's take another step back. Why does all of this matter? Think about everything that's going on here. Our kidneys are supposed to do a lot. They keep our sodium and chloride at appropriate levels. They get rid of extra potassium. Remember, we're responsible for getting rid of 90% of our daily potassium. So you should start to think about what could go wrong if that tubule is damaged, or maybe the whole nephron is damaged. Something's going to go wrong with our fluid balance and our electrolytes. Maybe our drugs or drug metabolites might start to build up, and so on. So wouldn't it be nice if all we had to learn about the kidneys is that they filter our blood? Well, while that is a very big part of what our kidneys do, they do much, much more. In addition to filtering blood, remember how they also regulate water balance. That tubule can secrete and reabsorb water. So imagine if it reabsorbed a ton of water, and now we're sending a ton of fluid back into the bloodstream. So if 21% of our cardiac output is going to the kidney, all of those nephrons can reabsorb a ton of water in each tubule. And we can pretty effectively increase our blood volume. It's kind of amazing just how the kidney can do that. So our kidneys can do the opposite too. If somebody drank too much water, they were hypervolemic, the nephron can now decide we need to dump a lot of that extra water into the urine. So not only will this affect how hydrated a patient is, it's also going to affect blood pressure. Lots of volume leads to higher blood pressure, and this talk of blood pressure leads to the next function of the kidney, renin. So secretion of renin is another key role of the kidney, and it doesn't just secrete renin all day. It secretes renin when there's a sign that the blood pressure might be low. It's kind of like the body signals the kidneys when there's a problem. My blood pressure's low, tell the kidneys to secrete renin. Now, what happens when renin is secreted? Remember the RAS system, renin-angiotensin-aldosterone system. So when renin is secreted, it starts a chain reaction. And at the end of that chain is a bunch of ways to increase blood pressure. So for example, secretion of aldosterone, which causes retention of sodium and water. Vasoconstriction, secretion of antidiuretic hormone or vasopressin. So many other mechanisms, but all of these increase blood pressure. So bottom line, body senses hypotension, the sympathetic nervous system kicks in and tells the kidney, secrete renin, and renin triggers that chain reaction to cause blood pressure to increase. So we've got filtration of blood plasma, regulation of blood volume and blood pressure as water is secreted and reabsorbed, secretion of renin, and there are still more functions of the kidney. So the kidneys also secrete a hormone called erythropoietin, and erythropoietin stimulates red blood cell production in the bone marrow. Our kidneys also help us regulate acid-base balance by reabsorbing bicarbonate, which is our base, and secreting hydrogen ions, which is an acid. Additionally, the kidneys are responsible for making something called calcitrol. And calcitrol is basically activated vitamin D. And this calcitrol or activated vitamin D helps us actually absorb the calcium we get in our diet. And it also increases tubular reabsorption of calcium. So in a sense, our calcitrol is keeping us from urinating out extra calcium as well. So our kidneys play a key role in serum calcium levels.